Hello everyone, and thank you for joining me today. My name is Amy Duff. I'm currently a nursing student at Indiana State University, and the presentation today is on the topic of infant mortality and more so focused on the dilemma and collaborative efforts to improve rates for African American infants. This is a topic I researched last semester in one of my classes, and I'm very passionate about it, and I want to meet the goal of raising awareness that this is an issue and what we can do about it, some collaborative efforts in order to improve the rates, as well as some resources for those in the community. First of all, let's look at the background of the topic. Just some highlights here. First of all, we want to say infant death is defined as infant death before the first birthday. And then looking at mortality rates, what the numbers that we're looking at in the data is the number of deaths per 1,000 live births. So really, infant mortality is a critical marker looking at maternal health, medical access and quality, so quality of care, quality of medical access. It reflects public and societal health and ultimately the growth and development of children, and then socioeconomic conditions. So really, when you're talking about mortality rates in a community, it's, a trickle down of all of these factors here, like, you're going to have its implications for maternal health and, overall development of the community based on your infant mortality rates. So looking at the actual data here, the United States ranks 27th behind other industrialized countries. I want to emphasize this is not a good number. This is not a great ranking. It's really unfortunate that we're kind of behind the pack when it comes to this issue. In 2019, 5.8 deaths per 1,000 live births. So that's back to that mortality rate. Some of the countries that are ahead of us, Japan, Sweden, Germany, have much, much lower rates than that. So we want to work on improving that. And that number is for the overall United States. The rate has declined in spite of still being behind the pack. It has declined each year starting in 1940. And that's related to just improved conditions overall, improved immunizations, food supply, milk supply, improved sanitation across the board. So those have all helped. So with that said, there's still a severe gap that remains between death rates in African American infants and white infants. And the goal here is to raise awareness and reduce that gap. Black infants are 2.2 times higher, have a higher likelihood of death. So we want to reduce that number. Looking at that, the dilemma that I'm proposing here, and it's a dilemma for all of us. How do we improve this rate? African Americans die 2.2 times more than white. So looking at the actual numbers, that's 11 deaths per 1,000 live births compared to 4.7 in whites. Infant death rate from preterm birth is 3.8 times higher than whites. And sudden infant death syndrome was twice as high, and that was a number from 2017. And African American mothers are more likely to receive little or no prenatal care or late care. And this is one that I feel is a huge ethical dilemma for nursing. There's so many things that can be done to improve this number and ensure that those pregnant mothers, are getting the care they need, and the babies are getting the care they need. Preconception, while they're pregnant, and after birth, it's a huge thing, and there's a lot of simple things that can be done to improve this number. So let's look at the causes of infant death in the United States alone. In all of the United States, the leading cause of death are birth defects, followed by preterm birth, which is birth before the 37th week of gestation, maternal complications during pregnancy, sudden infant death syndrome, which is referred to as SIDS, and injuries. Looking at the African American community in the United States, low birth weight, preterm birth is the #1 cause. Congenital malformations, maternal complications, accidents, and SIDS. Again, so let's focus here just on the one leading cause of infant death in the African American community, and that is preterm birth. So just broke out here some of the causes of that. So stress is a huge thing, whether it's physical, social, psychological. That's a huge implication. That comes from many reasons. We're looking at racism, dangerous neighborhoods, lack of social support or financial support. Other things that impact preterm birth are unhealthy behaviors, health conditions such as diabetes is a huge one. Worries during pregnancy, just the general, like worried about, your life is going to be changing. Judgment, these are all things that impact and are risk factors for preterm birth. Some of these are modifiable, some of them are not modifiable, and I would like to think as nurses we can impact those modifiable risk factors. So in order to do that, let's look at what we can do in these collaborative interventions, and this is just the tip of the iceberg. First of all, providing education, empowering Black women to participate in their prenatal care as much as possible, and I think a big part of that is listening. And what are you doing now? How do you feel about being pregnant? What is your support system? What do you need? Those are that's the key, is that listening and understanding, so then you can provide interventions to help support what their needs are. Improved health, promoting healthy lifestyles prior to conception, quitting smoking, not drinking alcohol, exercising, eating healthy. I mean, these are things that we hear all the time, and that's imperative when it comes to having a healthy body and preparing yourself to become pregnant. Prevention of teen and unintended pregnancies. This is a risk factor for preterm birth. So we want to see if we can collaborate to intervene, whether it be in schools or churches, community centers. This is somewhere where we can assess the need and promote a reduction and try to prevent these unintended pregnancies. Breastfeeding support. Breastfeeding is indicated for the first year of life. It's also something that's educated toward solely breastfeeding for the first 6 months of life. So any kind of breastfeeding support. This is the healthiest for your baby, and we need to be supporting our community, our African American community and moms on education and seeing what they need in order to have a good outcome with breastfeeding. Resources for supplemental nutrition programs. One that came to mind was Women, Infants, and Children, and this is a program where women can receive vouchers to go grocery shopping, and it supports nutritious foods and able to obtain nutritious foods for the mother and the children or the baby. Home visitation programs, resource identification. Moving on, I've provided some resources for you as just kind of a highlight of what's out there. I did a lot of looking around, and I found a website here just for general support of African American moms, information on diabetes management. The March of Dimes has programs that supports, birth outcomes and interventions for positive birth outcomes. Here's some tips for home prenatal care, things that you can do without leaving the house. Or maybe they do have some things where you have to actually leave the house, but I like it. What can we do with at home to help support a healthy pregnancy? Breastfeeding support. Meditation, so this is another free intervention to help reduce stress. Community partnership for financial resources, and as I mentioned before, the WIC program. Here's the references that I used in support. Of today's presentation. Thank you for joining me. And again, now that you've watched this presentation, please go take the post test and take a look at the flyer. Thank you.